Hello, my name is Michelle, and today I will be discussing precautions that a newly pregnant woman should take. So, the first thing I'm going to do is I'm going to check provider orders and see who my patient is. Now that I have my patient's information, I will go to her room, provide patient privacy, and introduce myself. So, knock knock. Hello, my name is Michelle. I'm going to be your nurse today. I'm going to provide patient privacy. Can I please have your first, last name, and date of birth? Thank you very much. I'm going to go ahead and perform hand hygiene. So I'm here to discuss some precautions that you should be taking as a newly pregnant mother and some tips and tricks that I'll give you in order to avoid those hazardous precautions that could affect you and your baby. Okay, so the first thing I'm going to do is I'm going to discuss specific foods that you should be avoiding. So the first thing you should avoid is you should not be eating raw meats, undercooked meats. You also should avoid eating pre-cut, unwashed fruits and vegetables. This is because they carry a specific bacteria called toxoplasmosis, and this can be debilitating to the baby's brain growth and nervous system. The next thing I would like to advise you against is unpasteurized dairy products such as raw milk and just raw cheeses, soft cheeses. This is because they carry a bacteria called Listeria, and this is caused to this affects the baby's birth weight and can cause miscarriages. Lastly, I would also advise against eating predatory fish because they contain high amounts of mercury. And these kind of fish are going to be swordfish, tuna fish, shark fish, marlin, and catfish. And mercury affects the baby's nervous system and can cause developmental issues. Additionally, I want to discuss some over-the-counter medications that you cannot take, and some of the supplements that I also recommend that you take. So the first thing that I would advise against is you should not be taking NSAIDs such as aspirin, Motrin, ibuprofen. This is because this can cause kidney issues for you and the baby. Some of the over-the-counter pain medications that I do recommend are Tylenol and Tums. So those are safe for you to take. And some of the supplements that I recommend for you to take are a prenatal vitamin. This will aid in helping your baby grow fully. And just supplement you with any extra vitamins or minerals that you are deficient in. DHA, that is very good for your baby's brain development also. I'm also gonna discuss a few environmental factors that you should be avoiding. The first thing you should avoid is going to places or anywhere that you could be exposed to lead. This is typically in older houses. This can cause blindness in babies and can cause them to die. It could cause a miscarriage. So you want to make sure that you are not going in anywhere that could possibly have lead. Additionally, you want to avoid pesticides. Pesticides are extremely toxic to your baby. This is because their liver and kidneys are not yet fully developed and they are not able to successfully get rid of those toxins in their body, and this causes birth defects. It could cause developmental issues, and it can also cause a miscarriage. Lastly, you should not be near any solvents or any strong chemicals. This can also be very damaging and cause slow growth. So these are going to be things such as degreaser, paint remover, any kind of hazardous chemicals that you mix. You always want to make sure you're reading the label. Some labels may advise against pregnant women not using these kind of chemicals. So the next thing I'm going to discuss is a very important topic. This is going to be substance abuse, alcohol, and cigarette use, and what it could do to you and your baby. So the first thing I'm going to discuss is alcohol. So alcohol can cause you and your baby severe effects. It could cause you to develop liver problems and multiple different addiction issues, withdrawal. It could cause the baby to get fetal alcohol syndrome, and this causes a stunted growth and developmental issues. And additionally, smoking cigarettes can be harmful to you because it increases your chances of obtaining heart disease and stroke. And when you smoke a cigarette, that goes into your bloodstream, and the nicotine and toxic chemicals go into the placenta, and the baby absorbs it. This is bad because it could cause issues such as cleft palate, and it could cause issues such as miscarriage or stillbirth. And it also causes developmental issues. And lastly, I want to advise against substance abuse such as cocaine, methamphetamines, and just different drugs that you are abusing. So, just to be clear, these are extremely dangerous to the mother and the baby. Um, it can cause the mother to overdose and go into cardiac and respiratory arrest, which can likely kill the mother and the baby. Additionally, you can get AIDS or sexually transmitted diseases by sharing needles. And lastly, your baby, if you do drugs while you are pregnant, it will cause the baby, and it can cause the baby to develop withdraw and be born addicted to drugs, and the baby will be withdrawing as soon as it is born. Additionally, it's important if you are going to travel. I just want to give you a few tips and tricks so that you do not run into any issues. So if you're having a healthy pregnancy, you can go ahead and travel, but I'm going to give you some information that you should know prior. So if you feel like you might be at any risk or you have any questions or concerns, please contact your healthcare provider. Some of the things I do want to give Some of the tips I do want to give you is to wear comfortable shoes. That is extremely important. You should also wear compression stockings because pregnant women are at a higher risk at developing blood clots, and that is because you might be sitting for long periods of time. I also recommend that you stand up and stretch your legs. Maybe you take a walk to the restroom and nicely take a nice stretch if you can. Stretch out your legs. Do leg exercises while you are sitting on your seat. Additionally, you want to find out where you will be traveling to and figure out where you can be seen if you have any health concerns or issues. Lastly, it is important that you carry your health record in case anything does happen. You should always want to have that health handy if you are pregnant. That way they could see if they already know what's going on, who your healthcare provider is, and they have information that they could go off of. Lastly, I do want to advise it is not a lot of airlines do not allow travel past 36 weeks, so it is better if you do it before you are heavily pregnant and in those later weeks, okay? So lastly, I will also be discussing dental visits. So it is important that when you find out you are pregnant that you get a full dental treatment and that you are seen to ensure that you don't have any kind of gum disease or dental disease. That way it could be fixed right away, because if you do have any kind of dental or gum disease, it is very important that you get it fixed, because if you do not, it can actually cause an infection which can be passed on to your baby and cause very harmful issues to the baby. Additionally, some women may be deterred from going to the dentist because they're afraid of getting an x-ray, but If the benefits outweigh the risk, and you do need to get an x-ray and have work done, it is important. Getting an x-ray while you're pregnant is a little bit risky, but having an infection or gum disease is riskier than getting an x-ray. Lastly, it is important that you get any work done before 20 weeks, because after the 20 weeks, you may be too uncomfortable to sit in a dental chair for a long period of time, and it would just be easier to get everything worked on prior to having a big belly and being uncomfortable. Additionally, I do want to say that it is very important that you maintain a healthy oral hygiene. That way you don't develop any kind of dental or gum disease. So that's about it. Do you have any questions or concerns for me? Okay, very good. Have a great day. I'm going to go ahead and chart everything, and that is it.